The interesting thing about cancer patients, in my experience having 23 years now treating cancer patients, is that sometimes patients choose convenience over really maybe the level of care that they want to receive. They may know that they could travel to Kansas City or Anderson or Memorial Sloan Kettering and get really top-notch care, but it's just more convenient for them to stay at home. That really isn't the right thing, right? So if we can provide that world-class care close to home for those people, we should. Ultimately, do rankings matter? No, I don't think that they matter, but they do showcase, and there is a reason there are rankings, right? I mean, there are a reason why people get recognitions like NCI designation. It's because you meet a certain level of expertise, and we clearly have that. Do we ultimately pay attention to what our number of ranking is? No, but what we do pay attention to is that we're delivering cutting edge care, that it's quality, and that it's safe. That's what's important to us. I really can't stress enough the importance of having access to subspecialists. You know, it's sort of an analogy of, you're not going to go to sort of a general engineer to fix your car. You want a car mechanic. You want a car mechanic that works only on Volvos. That's what you want. That's what you're getting when you come to a subspecialist, somebody who focuses only on a specific disease. We have people that really are within our field that focus on not just urologic cancers, but specifically only on bladder cancer. I mean, they're going to know that field better than anybody else, and that's critical. It's going to mean expanded access for sure. It means that people will be able to get care close to home, and it allows us to have better access to that care. So by expanding our number of locations, patients are not only going to be close to home, they're going to be able to get in quickly. That's really important. We make sure that all of our satellite sites are closely integrated. So again, you will receive the exact same care that you would get at Westwood or at Indian Creek. We have subspecialists at all these areas, and they are up to date, and they use the same treatments that we get. Also, as we mentioned, the same teams, right? So the nursing team, the supportive care teams, our pharmacy teams, they're all standardized across all these sites. So you're going to get that same great care that you would get by coming to the main campus.
I think we have an important role in Kansas City as the University of Kansas Cancer Center, as being able to provide world-class cancer care. We know that there's a number of hallmarks to that: the level of subspecialization that we can bring, the advanced therapies, access to clinical trials. But we also know one of the things that's important to patients in our community is accessibility and proximity to our services closer to where they live. And I think that's the biggest driver for us, is to assure that we have access points that are as proximate to patients and communities across Kansas City as is possible. About 25% of the patients that come to Westwood live north of the river. So now we will have access points, clinics, sites that will be much more accessible, much more convenient for them, and they get the same great world-class care that they otherwise would. I think the reality is Northland's big already. We know that it continues to grow. Frankly, if you look at the Kansas City area as a whole, the Northland is, I think, growing at a greater rate than any other area in Kansas City, in the greater Kansas City metropolitan area. And so it's important for us to have enough points of access, and I think conveniently located too, to highways, to the interstate. If you look at, our current Green Hills location, if you look at Briarcliff, great, easily accessible location. And then certainly we've made the commitment to be able to support the community of Liberty and Clay County by virtue of, our acquisition and the partnership with Liberty Hospital. Well, I think for patients, it means you're going to continue to get the world-class care that you would expect to get from the University of Kansas Cancer Center, but closer to where you live. And the hope is that that makes your ability to deal with your cancer, to deal with, frankly, the other things in life that are affecting you in a way that's much more convenient for you. That's really what we're striving to do, is to make sure that it's more accessible, more convenient, but with the same world-class care that you would expect at any of our other locations. We are one comprehensive cancer center. So our expectation, and patients should expect the same, is that you're going to see and you're going to get world-class care, and it's going to be coordinated, and you're going to have access to clinical trials, and you're going to get the same great nursing teams and pharmacy teams that you would get at any of our other locations. It's just going to be closer to where you live.
This is an exciting day. This is something we've been looking for a while now, and opening the cancer center here, starting to see patients right here on campus is very exciting. This is one of the promises that we made, to bring world-class services right here on campus for the people here in Northland, and especially cancer care. People have been very aware of the high-class care at KU for a long time, but bringing that here on campus so they don't have to travel that much is phenomenal. Yeah, most of these patients who are coming here for whether it's cancer chemotherapy, whether it's radiation therapy, they have to make several visits almost on a daily basis on several occasions. So traveling, not so much, especially to downtown. People really prefer to be close to home and be able to park right across and walk in and get their care and see their patients, see their doctors right here. We're starting the cancer chemotherapy and medical oncology services now, and we have radiation oncology equipment which is already in here and being installed, and by September we should be able to get that started as well. A couple of years ago, Liberty Hospital started looking for a partner, and when we went ahead with joining the University of Kansas health system, several promises were made. One of those is to bring high quality care right here on campus for the people here in Liberty and in the Northland, not having to travel very much to get the high quality care. And cancer care is one of them. And people have been really looking forward to getting that care right here, close to their homes.